On this Thursday night, horrifying error in Quebec. What first responders discovered in the woods, the colossal mistake they made, and the apology to a grieving family. Anxiety over Alberta's plan to scrap its pandemic protocols, including quarantine for those with COVID-19.
Just want to be safe, right?
The fears it's happening too soon. Immunization mission, new tactics from the U.S. president to push the reluctant to roll up their sleeves. And She the North.
They are giving us so much to cheer for.
How the women are hauling in the hardware for Canada at the Olympics.
Global National with Donna Friesen.
Good evening and thanks for joining us. We begin with a troubling story that defies explanation. Police in Sherbrooke, Quebec say they and the fire department mistook a human body found burning in the woods for a mannequin and dumped it in a garbage bin. It wasn't until about 8 hours later, after a man reported his wife missing, that they realized their terrible mistake. Mike Armstrong is following this for us, and a warning, the details are disturbing. Mike?
Well, Donna, this is a hard story to believe. It is a major mistake made by police and firefighters working together.
Alors, bonjour à toutes et à tous.
The Sherbrooke police chief walked through the details this afternoon of what went wrong. It started with a 911 call last Friday, just after 10 a.m. for a brush fire. When police arrived at the scene, witnesses said they'd seen someone burning a mannequin. Firefighters arrived, the fire was put out, and the decision was made to dispose of the mannequin in a dumpster at the police station. Now at 2:15 that same afternoon, a man called and reported his wife missing. Police tracked her cell phone and found her vehicle. It turned out to be on the same street where the fire had been. Now, some of the officers started to ask if the two incidents could be related. At 6:30 that evening, they checked the dumpster and realized the mannequin they'd thrown away in the garbage was in fact the missing woman.
Ça a choqué tout le monde.
The fire chief says what happened has shocked everyone involved. Not only are they investigating the major mistake, they're also having to manage the emotional toll it's taken on the team. Now, on top of trying to explain the error, there appears to be a murderer on the loose, and the mistake that was made won't help. Not only has time been lost where police could have been looking, but the crime scene's been turned upside down and potentially important evidence lost. Donna?
Really an unbelievable story. Mike Armstrong in Montreal tonight. Thanks. How to handle what happens next with COVID-19 is triggering quite a debate in Alberta. It has decided to treat COVID-19 like other respiratory viruses. Close contacts of those who test positive no longer have to self-isolate, and soon even those who test positive for COVID-19 themselves will no longer have to quarantine. Alberta's chief medical officer says the new approach is possible because so many people are vaccinated. Alberta is not leading the way, though, with vaccine uptake. Atlantic Canada leads the country with first doses. Prince Edward Island and Newfoundland and Labrador, more than 77% of the population there has received at least one dose. Nunavut has the lowest percentage in the country, just over 57%. In Alberta, almost 64% of people have had at least one shot. That leaves a big group of people, mostly young people, unprotected. And though learning to live with COVID is the long-term goal of every country, medical experts say there is a risk in moving too fast. Heather Yourex-West reports.
You want more swing?
It's been a long 18 months for Brooke Boning. The Calgary mother says her family is ready to move on from COVID-19.
I think life eventually just needs to go back to normal and people are getting vaccinated.
Boning says she was happy to hear the province is moving away from its pandemic response plan, scaling back testing and contact tracing, even dropping the legal requirement that those who test positive for the virus quarantine. But within the medical community, there is plenty of concern.
I don't want to take this on. I don't want to take on this government. I just want to be safe, right? And that's the only reason why I've ever fought, is so that my kids are safe.
There is a general feeling of shock amongst the colleagues I work with in the hospital that we're doing the absolute wrong thing.
That's because Alberta's vaccination rate is far below what's required to hit community-wide protection.
I think the concern remains that we have over 1 million unvaccinated Albertans, rapid viral spread, and those people are at risk of perhaps severe illness hospitalization and even worse outcomes.
Across the country, the number of new daily COVID infections is beginning to rise. It's why most other provinces have remained cautious, keeping much of their pandemic response plans intact.
We are going to continue with a pathway that keeps the vast majority of Ontario citizens safe, and hope that people do the right thing and get vaccinated as soon as they can.
Alberta's top doctor says the province needs to shift resources to prepare for other health threats, like the expected return of the seasonal flu. Still, Dr. Dina Hinshaw says COVID-19 has not gone away, and if required, the province's response plan could change again.
If we see a new variant that's spreading that vaccines don't protect against, if we're seeing a surge, particularly in a localized area, a surge in cases that's leading to severe outcomes, then we absolutely will be looking at interventions in those locations.
But other than that, Alberta is turning the page, launching a province-wide experiment on whether now is the time to do this safely. Heather, Yourex-West, Global News, Calgary.
The U.S. is on a different path. Vaccination rates have dropped off there, even though the country has more than enough doses for everyone, and that is prolonging the crisis. Today, President Joe Biden jolted the holdouts with a tough new approach.
With freedom comes responsibility. So please, exercise responsible judgment. Get vaccinated for yourself, for the people you love, for your country.
He is not making vaccines mandatory, but he is coming close. The aim is to make being unvaccinated such a hassle and so restrictive that people roll up their sleeves. Jackson Proskow on President Biden's plea to the unvaccinated.
In a return to the worst days of the pandemic, hospitals in parts of the U.S. are nearing the breaking point. 2/3 of U.S. counties once again have high or substantial levels of virus transmission.
This Delta variant that we're seeing now changes the game from my perspective.
Despite ample access to vaccines, only half of eligible Americans are fully vaccinated. The pace of inoculation has slowed to a fraction of what it was in the spring.
We're at the point now where one individual's refusal to get vaccinated, it's having an impact on other people. And when your actions compromise the health of someone else, that's when an appropriate time to intervene in the form of a mandate.
Frustrated by the stalled vaccination effort and the surging virus, President Joe Biden is calling for $100 payments to newly vaccinated Americans and is giving millions of government workers an ultimatum: get the shot or face mandatory testing and on-the-job restrictions.
And you want to know how we put this virus behind us? Well, I'll tell you how. We need to get more people vaccinated.
Corporate America is going further. Facebook and Google will require vaccination for all employees who return to the office. Some restaurants have decided to make vaccination mandatory for both employees and customers.
We can talk about so many other issues with COVID, but if we're not talking about vaccination, then we're not talking about the solution. You want a recovery, you need vaccination.
In a country so split over vaccines, ethicists warn pushing too hard or mandating vaccination could actually backfire.
We have to be pretty clear that we've tried everything and that everyone, including vulnerable people, has had full access to the vaccines before we make a decision of that magnitude.
With the virus once again circulating widely and spreading rapidly, scientists warn this half-vaccinated nation will need to do more quickly.
The only thing that's going to limit the spread is a combination of regular testing, mask mandates, and really making sure that everyone is vaccinated.
The president has also directed the Pentagon to determine when the COVID-19 vaccines can be added to the list of mandatory vaccines for members of the U.S. military. And of course, Donna, the backdrop to all of this is the fact that masks are once again mandatory in many parts of this country, regardless of vaccination status.
And Jackson, the president can't tell states and private companies what to do, but he did send a strong message today that they can force employees to get vaccinated or get regular tests. What did he say?
That's right. He says he's looked into this, and yes, companies can mandate vaccinations if they want. Local jurisdictions can do it as well. Whether or not the federal government could do that on a national scale remains an open question, according to the president. But Donna, you can bet one way or another these mandates, no matter how big or how small they are, will all but certainly end up in court challenges.
All right, Jackson Proskow in Washington, thanks. An American is one of 2 pole vaulters at the Olympics who have tested positive for COVID-19 and are out of the competition. Sam Kendricks won a bronze in 2016 and is a double world champion.
I have no recourse but to sit in isolation and watch the Olympics.
Kendrick's positive test result sent the entire Australian track team into brief quarantine. 3 of them had come into contact with Kendricks. They've since tested negative. A pole vaulter from Argentina also has COVID and is also no longer competing. Canada has 5 new senators. They are independents recommended by the Independent Advisory Board for Senate appointments and appointed by the new Governor-General. Here are the faces who will fill 5 of the 105 seats in the Red Chamber. They're an eclectic mix, representatives from Alberta, Saskatchewan, and Quebec. Michelle Odette was a commissioner for the National Inquiry into Missing and Murdered Indigenous Women and Girls. Karen Sorensen was the mayor of Banff. You can read more about all the appointees on our website, globalnews.ca/globalnational. For the first time, a former American cardinal in the Catholic Church has been charged with sexually abusing a minor. 91-year-old Theodore McCarrick faces 3 counts of indecent assault and battery on a person over 14. The alleged incident happened at a wedding reception in 1974. The boy was 16 at the time. McCarrick was defrocked by Pope Francis in 2019 after a Vatican investigation found he sexually molested adults and children. McCarrick is the highest-ranking Catholic Church official criminally accused in the sex abuse scandal in the church that's gone on for decades. Pointing the finger at Malta's government coming up, why it's being blamed for the assassination of an investigative journalist. Plus, raging infernos, the deadly wildfires decimating Turkey's coast. And a slice of history on the auction block. What's so special about this 40-year-old piece of cake? Crews are struggling to contain multiple fires burning in southern Turkey. Dozens of fires have erupted across the region. At least 3 people have died and dozens are injured. 30 villages are under evacuation orders as strong winds and hot weather fan the flames. An investigation into what caused the fires is underway. It's suspected some were acts of arson. A public inquiry into the assassination of an investigative journalist in Malta has found the state is responsible for her death. Daphne Caruana Galizia was killed by a car bomb as she drove from her home in Malta in October 2017. The 53-year-old journalist was described as a one-woman WikiLeaks who exposed corruption in her country and abroad. The inquiry found the state created an atmosphere of impunity at the highest echelons of power and failed to recognize risks to her life and take reasonable steps to avoid them. Her murder caused outrage across Europe, and the investigation led to the resignation of then Prime Minister Joseph Muscat last year after his close associates were implicated. Keeping COVID out but letting loved ones in. Still ahead, the pressure on hospitals to allow visitors. Going through medical treatment is stressful enough. Having to do it alone makes it all worse. Yet in many hospitals, strict no-visitor policies put in place at the start of the pandemic still exist. Only now, when so many people are vaccinated for COVID-19, they may be doing more harm than good. Caryn Lieberman reports.
I was re-diagnosed with stage 4 metastatic breast cancer about a year ago.
For the last few years, Heather Lisa of London, Ontario, has been fighting to save lives. First on the front lines, helping others as a respiratory therapist, and now as a cancer patient undergoing treatment.
It's terrifying. It's lonely. It's confusing.
Lisa has had to do it all alone.
To get my diagnosis by myself I had my husband on the phone, I can't even describe it.
Restaurants in Ontario are once again filled with patrons. Moviegoers can flock to theaters, but in many cases, loved ones can only provide support to family members undergoing medical treatment from a distance.
We didn't have enough PPE. We didn't know enough about COVID.
During the first wave, fearing the spread of COVID-19 and experiencing a surge of patients, hospitals closed their doors to visitors. Now there are calls to loosen restrictions.
Family and essential care partners with strict infection prevention control measures do not play a major role in the transmission of COVID into the hospital.
When Diane Guy of Belleville suffered a stroke, her husband called 911. She was rushed to hospital and underwent surgery alone.
I'm in there and my mind is just gone. I'm just petrified, and the doctors talking to me and I had no idea what they were saying or anything.
The impact of strict no-visitor policies at hospitals across Canada was felt not only by the sick.
In addition to caring for patients, we found ourselves also being placeholders for their families.
At Toronto's Humber River Hospital, effective this month, a move to safely reintroduce family to the bedside.
Prior to this, we had 24/7 open visiting. And so we're not quite there yet, but we are a step closer.
But visitor policies vary from one hospital to the next, one unit to another. Heather Lisa is hopeful to have her family at her side for her next appointment.
I don't see a reason why a fully vaccinated family member wouldn't be able to accompany me to appointments at this stage.
Caryn Lieberman, Global News, Toronto.
A slice of history is up for auction in England 4 decades after it was served. It may not be quite as fresh as it was at the wedding of Charles and Diana in 1981, when there were 23 official wedding cakes served, but this slice is considered precious. A member of the Queen Mother's household kept it, preserving it in plastic wrap inside a tin. The slice is expected to fetch somewhere between $400 and $700 when it's auctioned off next month. Oh, and the auction house says we advise against eating it, just in case you need that advice. A woman's place is on the podium next. Team Canada keeps hauling in the medals. Canada's most decorated summer Olympian, Penny Oleksiak, could break another record tonight. A podium finish in the 100-meter freestyle final would make her the only Canadian with 7 Olympic medals. Global News spoke to Penny's mother and sister today ahead of the big race.
We're probably way more stressed than she is. Or maybe it's just me that's stressed.
Well, my mom is very superstitious, so she makes us all come to the same spot now every day. Because after her first race went well, that we were all sitting in the same spot, my mom's insistent that we all come to the same spot.
Oleksiak is inspired by American swimmer Michael Phelps, the most decorated Olympian of all time. Her family says she speaks to him on a regular basis.
And I think hearing from him that you really don't need to feel like the weight of the world's on you. As long as you're sort of focused on what you want to do and you're comfortable and you're happy with what you've done and you feel that you've put all your energy and effort into it to be the best that you can be, that's enough. And I think hearing that from him, I think really took on a different perspective for her, and I think really helped her.
Such good advice. Penny Oleksiak is part of Team Canada's strong start at the Tokyo Games. After 6 days of competition, Canada has 10 medals, 2 gold, 3 silver and 5 bronze, putting us in 12th spot for total number of medals. All 10 of those medals have been won by female athletes. It is inspiration to younger athletes setting their sights on future Olympics. Redmond Shannon looks at why the women are dominating the start of these games.
Kaylee Filmer and Hilary Janssens take bronze in the coxless pairs. It means as of Thursday, Team Canada's medal tally is 10. 10-0 for the women. From swimming to softball, lifting to diving, it's all about the women.
This is just a huge celebration of women in sport. And they are giving us so much to cheer for and really to be proud of.
One reason for this could be simple math. At recent Summer Games, far more Canadian women qualified for events than men, and that is being reflected in the medal count, with female athletes outshining their male teammates. Another reason could be the schedule. Many sports with a legacy of female Canadian success are in the first week.
There's no question that swimming and rowing are just powerful for us, but also we've made some breakthroughs with judo and non-traditional women's sport.
Angela Schneider won silver in the coxed fours in the less equal days of 1984. But even then, she noticed why Canadian women could succeed.
I was so shocked when I went there to see the way other women were treated. We were treated so well in our country, comparatively speaking.
In the pool.
Canadian Women and Sport is an organisation that works to help girls stay with sports. Even in Canada, girls are 3 times more likely than boys to quit sports in their teenage years.
They lose confidence in their body image. They lose confidence in their skills as they go through those teen years. Sport can be a place when we're aware of that sort of thing. Okay, let's design to counteract those sorts of things.
Alison Sandmar-Graves says the recent controversy over the Norwegian handball team uniforms was an example of why women can feel uncomfortable in sports. Success, she says, is making more girls feel welcome. Olympic medals are a happy bonus, more than a final goal. Redmond Shannon, Global News, London.
And that is Global National for this Thursday. I'm Donna Friesen. Tonight's Your Canada is this beautiful field of sunflowers in Lorette, Manitoba. Matches my jacket. Thanks for watching. Neethu Garcha will be at the anchor desk tomorrow, and I'll see you again in August. Take care of yourselves. Bye-bye.